My name is Dr. Rakesh Singh, a pediatric cardiologist and medical director of the Heart Failure and Transplant Program at Hassenfeld Children's Hospital at NYU Langone. So I originally decided to become a doctor because I really enjoyed science, and then I also realized I loved working with people. So that was the nice natural combination of those two fields. And then along the way, I realized that I really enjoyed working with children and helping them through difficult times. And that's how I ended up as a pediatric cardiologist. So I specialize in taking care of children with acquired or congenital heart disease that leads to heart failure and possibly heart transplantation. So heart failure is where the heart muscle is weak and doesn't function efficiently. In some patients, it has to do with the fact that the heart is not squeezing well. And in other patients, it has to do with the fact that the heart's very stiff and not able to relax. That tends to mean the children are not able to keep up with their friends, and their quality of life can sometimes be affected. The most common question I get is, what kind of life would my child have? And that's the most important question. And so I like to address that initially as much as I can. And while there'll be bumps and curves along the way, for the most part, these children can lead long, healthy lives. I think the most important thing you do is to give them hope. The vast majority of the children that I take care of who have heart failure or need a transplant do very well. So what I tried to do at that first initial visit is to give them a sense of where we're going, and that very likely they're going to lead a normal, healthy life. I think a patient should come here to NYU for treatment of heart failure because we have the expertise to provide the child with the best outcomes. And I think just as importantly, we have the environment to support the family through this very difficult process. From the beautiful facilities to our extended care team of social workers, child life specialists, nurses, and so forth, it really makes the family feel like they're taken care of all along the way.